Summit Health Group is a new way when it comes to thinking about how to provide primary care and physical medicine to a broad spectrum of our patients. We're able to combine new ways of treating patients that traditionally hasn't been available in the same location. We have multiple providers in-house, so we can see a lot of people. Our goal is to get patients in when they're sick or ill, when they need it. And at the same time, physical medicine encompasses a huge spectrum of patient care. So when I have a patient who needs physical therapy or chiropractic care or maybe even massage therapy, I'll walk them over and we'll get them scheduled the same day. Maybe they need an x-ray. We'll walk them over and take care of that same day. Maybe they need a blood draw or an EKG. We'll take care of that right here on the spot. Bottom line is we try to do as much as we can in-house for our patients.
I always knew that I wanted to help people in some form. I knew that I wanted to serve people. I managed the physical medicine department. Physical medicine is a broad spectrum of services that have to do with pain, with chronic pain. At Summit, we're able to give the cutting edge, the best technology, while still maintaining the feel of a classic, down the street, local community doctor that cares about their patients.
I came to Summit with an injury, and it was great because I could see everybody under one roof. I didn't have to go multiple places, and the doctors worked together to come up with the right treatment plan for me.
My main role is primary care medicine, and I also interact with the chiropractors and physical therapists. And I like that we're all under one roof, and I can bounce ideas off the therapist, off the chiropractor, treating the patient, developing a treatment plan, and monitoring their progress. I started working with Dr. Shani about a year ago, and he is by far the best chiropractor I've ever had the chance to work with. The patients come from far away just to see him, and it's amazing how they get better and how they thrive, and I feel great to be part of that.
Started off with Dr. Wilkes, and now I've been coming with Dr. Shaneen and Dr. Troy, who've been working on my back. I work for the fire department, and there's always some type of injuries coming on, so this is kind of like a one-stop deal for me, and it's worked out great.
What drew me to Summit Health Group is what drew me to medicine in the first place. I really have always been that person that feels the need to put things right, and medicine is a mystery of health and healing and how those things can be affected. And Summit Health Group very much manifests the same vision and commitment that I have followed for the last 17 years in private practice. It's really a blessing to be a part of this group.
When you walk into our office, you'll see and feel right away that we have gone the extra mile when it comes to providing a comfortable, modern medical office that feels inviting and warm. And you'll see right away that we have invested in the most modern medical equipment that we can to provide our patients the best care. One thing that I believe sets Summit Health apart from many offices is the quality of our staff. From the time you walk in the door to the time you leave the office, every point you touch, every person that interacts with you, their whole goal is to make sure that you feel like you're the most important person.
Putting egos aside, and you're putting the patient at the forefront of what really needs to happen. And when a physician is able to talk to another doctor and talk to physical therapists and talk to the chiropractor and collaborate, the level of care and the kind of care that the patients get are incredible.